Good morning, everyone, and welcome. The webinar is brought to you by Strategies 2.0, a statewide collaborative funded by the California Office of Child Abuse Prevention. Today's webinar is Understanding How Experiencing a Traumatic Event Can Impact One's Mental Health Well-Being. The webinar is scheduled from 10 until 11:30. My name is Carrie Collins, and I will be facilitating the webinar today. My role is to introduce the topic and the presenter, keep track of time, and help the presenter and participants in any way that I can. Assisting me today is my colleague, Alma Tovar, which I really appreciate. In a moment, I will introduce our presenter to you, but first I want to go over a few of the go-to-meeting guidelines. So all of you should have a toolbar with this little red arrow that you can control either opening it or closing it, whatever your preference is. You have joined us today either by telephone or by your computer microphone. Sometimes when you're using your computer microphone speakers, the sound is not as good as it could be if you were on your telephone. So if you find that the sound is not what you would like, then just switch over in the audio, where there's a little plus sign by audio. If you click on that, you can choose telephone. It will give you a phone number to call in with an access code and a PIN number. So that's your preference, what you want to do. We do have some videos today. So we suggest that if you're on your telephone, that you have your sound all the way up, or if you are on your computer speakers, that you have that sound all the way up also, so that you can hear the videos. Maribel is going to be asking several questions during the process of this presentation today. So we invite you to participate by putting your answers into the chat box. We will also have a couple of polling questions that will come up, and then you will select your answers in the polling question, and we'll see what the general response is from the audience. If you have a question, you can either put the question in the chat box, and Alma, Maribel, and myself will be monitoring that chat box today to ask those questions to her. Or if you want to ask the question yourself and you raise your hand, at that point we can unmute you, and you can ask the question to Maribel in person, whatever your preference is. I have muted all of you as of right now, except for myself, Alma, and Maribel. So don't worry about any background noise that you might have in your home or in your office setting, because all of you are muted this morning. The materials from today's presentation are in your materials section of the go-to training. They also will be sent to you via email following the presentation. So at this point, I would like to introduce Maribel Luna to you. Maribel is from Children's Bureau, which is also the organization that I work with. Children's Bureau is a nonprofit organization that provides mental health services to children and adolescents between the ages of 0 to 21 to prevent mental health disorders later in life. Maribel is a mental health outreach specialist for Children's Bureau and works with the outreach specialist team to create educational presentations to provide information on mental health in order to raise awareness in the community. This helps bridge the gap between the community and the agency to ensure that caregivers, like many of you that are joining us today, have the resources and information needed to improve the quality of life for many children and families facing mental health conditions. The reason why we asked Maribel to give this presentation today is because there have been traumatic events that have happened in the state of California over the last couple of years. So probably there is a heightened awareness around mental health issues for all families and children of all ages. So at this point, I am going to make Maribel our presenter. So hold on just a second while I do that. And then she will take over and show her screen with you. So there it goes. Okay.
Hi everyone, is it working well?
We can hear you just fine.
Okay, thank you. My name is Maribel, and I'm a mental health outreach specialist with Children's Bureau, and I want to thank you all for joining today's webinar. Today we're going to be talking about mental health, specifically focused on depression, trauma, grief, and then different types of trauma that someone might undergo that can impact their mental well-being. So our agenda for today is Carrie helped introduce me, and then we're going to talk about what is mental health, the difference between mental health and then what is mental illness, why is mental health important, and then we're going to go over what is depression, trauma, grief, community violence, what are the 5 stages of grief, and then how can you help someone who might be undergoing a mental health illness, and what are different signs that you can see that you're aware, and how can we help connect them to the resources to make sure that they get the adequate help. So we're going to start by watching a video. The video is in Spanish, however, there are English subtitles. And in the video, it talks about the different services that Children's Bureau provides and how spending time with your child or adolescents can really make a significant difference, and what are different behaviors we can observe in our child that would indicate that they might be undergoing a mental health illness, and how can we help connect them to resources, whether it's through Children's Bureau or other mental health agencies in our community. So, give me a second.
Amigos, ¿qué tal? Buenas.
I'm so sorry. Give me 1 second.
¿Sabían ustedes que 1 de cada 5 niños tiene o tendrá una enfermedad mental seria? Es por eso que mucha atención a los padres de familia, porque hoy estamos aquí en compañía de Ama Reyes.
Can I remove the toolbar from my screen, Carrie, or is that something everyone can see?
You can, and then we can't see the subtitles. So whatever you did yesterday to help me see the subtitles. There we are. Perfect.
Thank you.
Buenos días. Buenos días. Sí, muchas veces los padres no nos damos cuenta de las dificultades que presentan nuestros niños, y es por eso que debemos estar bien pendientes de las señales. Eso es muy importante. Por eso tiene algunas señales que se pueden detectar en los niños o en los adolescentes. Las primeras señales de salud mental pueden ser, por ejemplo, que tú veas que tu niño tiene un cambio de comportamiento. Puede ser que se sienta más deprimido, o con ansiedad, o que tengan ira. Muchas veces también bajas calificaciones. Esos son los primeros cambios. Claro, por eso es tan importante estar en el día a día con nuestros niños. Cuéntanos sobre los servicios de salud mental que ofrecen en Children's Bureau. Ofrecemos diferentes tipos de terapia, como terapia individual para los niños, tenemos también terapia familiar, y más que todo el reforzamiento de las capacidades positivas de los padres. Les enseñamos estrategias básicas para poder mejorar el funcionamiento de los padres y los niños. Es increíble, pero con solamente 10 minutos al día, ustedes pueden perfectamente observar y atender a su niño. No es tanto el tiempo, es más la calidad del tiempo. Con estos 10 minutos al día, ustedes pueden también visualizar cambios en el comportamiento de su niño y ustedes pueden mejorar el funcionamiento. Excelente. ¿Cómo pueden esas familias que nos están viendo acceder a los servicios de salud mental de Children's Bureau? A través de nuestra página web, básicamente, es all4kids.org, o a través de nuestros números. Gracias por la información, y es muy importante que ustedes sepan que con la misión de proteger a los niños vulnerables a la vida.
Okay, sorry about that. So here in the video, it talks about how spending time with our children and just really taking the time to talk to them can help make a big difference, because sometimes they might be going through stuff at school and we're not aware of that. Especially now with the use of like social media, it's really important to just be aware of what's going on so that we can help see any behaviors that might indicate that they might be going through something. So what is mental health? Mental health includes our emotional, sorry, I'm trying to move this. Mental health includes our emotional, psychological, and social well-being. It affects how we feel, think, and act, and it also helps determine how we handle stress, relate to others, and make healthy choices. And I've provided the translations in Spanish as well. So here's like a cute little picture that states when we are feeling well, when our mental health is well, it allows us to tackle the normal difficulties of life. It allows us to be aware of our own abilities. We can work productively, and it allows us to contribute to our community, whether that's for adults going to work and being able to do the work that we need to do to help others, or whether that's a child or adolescent being able to go to school, do their schoolwork, relate to their peers, talk to their teachers. So it allows us with our daily functioning. And then you can see a little brain, and they're like strong. However, when we're not feeling well, that might be indicative of a mental illness. So mental illnesses are conditions that affect a person's thinking, how they're feeling, their mood, or their behavior. And such conditions may be occasional, or they can be long-lasting, and in those cases, they would be chronic. And they can affect someone's ability to relate to others and function each day. So to the right, there's an image of a boy trying to sleep, and he's thinking about all these different things, whether it's like how he's going to get to school, or his car, or having to pay rent. And we all have daily stresses in our life, but if that's something that we're experiencing often and it's starting to affect our daily functioning, that might be indicative that there might be a mental health illness. And then to the next picture is a girl who's in bed and she's trying to sleep, or maybe, trying to get up, but she's sad, she's crying. So if this is affecting our emotion and we're feeling a certain way often, it might be also an indicative of a mental health illness. And then the last picture is an image of a woman who broke something or a plate. So if, everyone goes through certain things in our life, but if we're reacting a certain way to these things, it also might be a behavior that shows that, we're not feeling okay. So that's something you observe in somebody else, or maybe in our own self. That might also indicate that the individual might be going through a mental health illness. And then why is mental health important? When we're not feeling physically well, we usually go to the doctor. Maybe we have like a stomach ache or a headache. We'll go to the doctor for those symptoms, right? Similarly, our mental health and our physical health are equally important for our overall holistic well-being. And so when, if especially with depression, if we're feeling sad, often it might start affecting our lifestyle. We might not want to go outside, or we might not be, getting the physical exercise that we need. It might start changing the way that we sleep, whether we're sleeping too much or less. We might be eating more than usual, or we might be eating less. So that can then start affecting our physical well-being. And similarly, with our physical well-being, if you're suffering from a chronic illness such as like type 2 diabetes or heart disease, or a chronic health condition, if we're constantly thinking about it and it's affecting our physical health, it might end up impacting our mental well-being as well, because we might get sad over what's happening with our physical health. So they're both integral for our holistic well-being, and they're both just equally important. So I want audience participation, and for this question I ask that you answer in the chat box whether you think it's a yes or no. Do you think children experience mental health disorders? And then to the right,
I'm going to send out a poll. Maribel, I'm going to send out a polling question.
Yes.
So
okay.
They'll answer the poll and then put in the chat box how this impacts them. So right now I'm going to launch the poll. So hopefully you all see that, and go ahead and select your yes or no. I'll wait for some more votes to come in. Okay, I'm going to close the poll in 5 seconds. Okay, I'm going to close the poll and share the results. Not surprising. And then I will hide, and then you want them to put in the chat box how this impacts them. Okay.
Correct, yes. Thank you. And then on the right, there's a poster that says your kid, like, what do you have to be sad about? But, you know, we all go through things, so what are your thoughts?
Daily functioning, it can impact their behaviors. I'm reading what they're typing. Can impact them by making school attendance, performance, poor relationships with friends and family, deteriorating. Let's see. That's it.
Yeah, thank you for reading those. Yeah, you're right. Those all can have an impact on their like ability to go to school, how they relate to their classmates, whether they do their homework. Because if they're going through something, they might not be able to do well in school, or may not, you know, want to go to school. Sometimes I attend START meetings. They're the Student Attendance Review Board for the District of LA. And a lot of cases, there sometimes is like a connection between school attendance and like mental health condition happening that starts affecting like whether children want to go to school or not. So they also go through things just like adults. So thank you for answering that. And some statistics is even very young children may show early warning signs of mental health concerns. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders actually happen before the age of 24. So it's a very pivotal stage, like before the age of 14. If a child is going to be impacted by mental health disorder, those signs actually happen before the age of 14. So yeah, just something that we should be aware of. And then this is our second question. It's a chat box question. We want you to see the 3 images, and then what is your interpretation of these pictures? So you can take a minute to answer. Thank you.
Go ahead and put into the chat box your interpretation of these pictures. Very nice. And Alma, you can go ahead and start reading.
Okay,
some of these.
let me see. Self-image, depression, bipolar. The interpretation is what you are feeling and what you really show, what you're experiencing versus what others are seeing. Wearing a mask in public, hiding your true feelings.
Yeah, those are all really great. Thank you for sharing. It's like what you're feeling versus what others are able to see on the outside, and that was a really great response. Because we might be going through something, and but physically people sometimes can't tell. That's why it's really important to talk about how we're feeling. Especially because sometimes there is a stigma around mental health, and we don't want to verbally say what's happening, but the more that we talk about it, the better we're going to feel, and the more that we're going to build like a community where people can share how their own experiences, and it's going to allow others to also speak up. So thank you for sharing. And then this is our next question. To true or false, it's a polling question. So weakness in character leads to mental health illnesses, and people with mental health problems can control it if they choose to. So do you think this is true, or is this false?
I've opened up the poll. I'm going to keep the poll open for another 5 seconds. Okay, I'm going to close the poll and share the results. So we did have a couple of truths and the rest false.
Okay. So yeah, this would be false. There's some posters that say like, just stop being so negative. You're fine, just go their day. Which are common things. Sometimes people might say that, and but actually there's a lot of different factors that can affect one's mental well-being. Sometimes it's biological. Sometimes certain genetics can cause a mental health condition later in life. Sometimes there's chemistry in our brain that can change later on in our life as well, and it might just happen like spontaneously where a mental health illness happens. A life experience can also trigger a mental health disorder, such as trauma or history of abuse. Going through a traumatic experience can then also impact how our mental well-being. And then if there's a family history of mental health problems, that can also cause a mental health condition. So again, that's why it's really important that we talk about mental health and how we're feeling so that we can like open up a space and community around it. But thank you all for sharing again. And then these are more statistics by the Pan American Health Organization. And it says that 50% of mental health disorders in teenagers appear before they are 14 years old. And then, so if there is a mental health condition that's going to happen, half of those disorders happen before the age of 14. So very pivotal stage again. And then mental illnesses are the most frequent cause of disability in adolescents worldwide, and affects every aspect of their health and development. It affects their physical health, their mental health, and also their like social well-being, their ability to relate to their peers. Depression is the most common, third most common disease among adolescents, and then suicide is the second cause of death among adolescents ages 14 to 29. So that's pretty alarming. And again, if we talk about it, we can know whether someone is undergoing a mental health illness so that we can help connect them to the proper resources, because sometimes, unfortunately, you know, we are going through something, we might not want to talk about it. And again, this is something that we can help prevent. And then worldwide, 800,000 people die of suicide worldwide. So that's a really big amount. So these are some statistics surrounding mental health. And then we're going to shift a little towards depression. Our next question is, what is depression and how does it affect people? So if you can answer in the chat box.
It's a mood disorder. A feeling of sadness. Chemical imbalance in the brain. Depression is low energy and mood. It affects socialization, activity, health, and overall sense of confidence. People around us often do not know how to help. Low serotonin uptake. Feeling of sadness, isolation, poor appetite, withdrawn from others. Fatigue, they're going too fast. It's a quiet disease. Mental health disorder, depressed mood, loss of interest in activities, impairment in daily life.
Yeah, thank you for sharing. Those are all correct. It can happen spontaneously, and it can affect the chemical changes in our brain, causing like a chemical imbalance. It can affect changes in sleep or appetite, and it can cause feelings of sadness. So I'm going to show a video by Nami that talks about what depression is. Sorry about that. So that was a video by the National Alliance on Mental Illness, and they outlined some more information around depression. So what can cause depression? Depression does not have a single cause. It can happen or be caused by a life crisis, a physical illness, or it can also happen spontaneously. The cause of the disorders, such as depression, can be caused because of our genetics, or it can also be our environment that can cause the depression. And then people who experience prolonged stress or major loss, bereavement, divorce, job loss are at an increased risk for depression. And then other factors that can cause depression are trauma, life circumstances, changes in our brain chemistry, other medical conditions. So if you're going through like a chronic health condition, that can also cause depression or lead to depression. Drug or alcohol misuse can also affect like our brain, and it can also happen spontaneously. So I think that last one's really important because it can also be just a chemical imbalance that can later lead to a mental health illness. And then more statistics on depression. According to the Los Angeles County Department of Public Health, depression causes severe symptoms that affect how one feels, thinks, and it can have an impact on our daily activities, such as sleeping, eating, or being able to go to work. People who experience prolonged, I had just already stated this one, but if there's also a family history of depression, it can also impact the disorder for others. And then some more statistics from the Los Angeles County Department of Public Health. People of all ages and all racial, ethnic, socioeconomic backgrounds can be affected by it. However, it might affect some groups more than others. And then more than 17 million United States adults, over 7% of the population, had at least one major depressive disorder in the past year. And this was County of Los Angeles Public Health in August 2017. So 2016 that this information was gathered. And then major depression and other depressive disorders affect 1 in 10 adults each year, and it is the leading cause of disability in the United States. So some common symptoms include, as some of you have stated earlier, changes in sleep. Either the individual might be sleeping more than usual, or they might be sleeping less. So that is like a sign to look out for. Changes in appetite, maybe the individual is not eating a lot, or they might be overeating. Difficulty concentrating, there might be a loss of energy, fatigue, lack of interest in activities that the individual once enjoyed, they might not find interesting or not have like that much joy from them anymore. Feelings of hopelessness or having guilty thoughts. Changes in movements might also indicate that someone is going through a mental health condition such as depression, so less activity or agitation. And then the individual might be feeling physical aches and pains, or they might have suicidal thoughts. So we'll go over this more later on, but if you do hear like, I don't want to be here anymore, the world would be a better place without me, or increased thoughts of death. Those are all red flags to look out for. And again, if that is the case, like, it's important to seek immediate help. And if you think someone might want to hurt themselves, the best thing you can do is call 911 and they can help connect you and make a professional evaluation to move forward. Some other signs and symptoms of depression include persistent, sad, anxious, or empty mood, feelings of hopelessness, or being being pessimistic, being irritable, feelings of guilt, worthlessness, or helplessness, loss of interest in pleasure or hobbies and activities, having decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still. And then also having difficulty concentrating, remembering, or making decisions, difficulty sleeping, waking up really early, or oversleeping are also signs. Appetite and or weight changes, and then thoughts of death or suicide attempts, and then aches or pains, headaches, cramps, digestive problems can also be different signs of depression. And so now we're going to switch over to trauma. There's different types, and we'll go into more detail right now. So trauma is an emotional response to a terrible event. Examples can include being in a car accident, undergoing sexual abuse, or being in a natural disaster or witnessing a natural disaster. Psychological trauma happens when a sudden, unexpected, intense emotional blow or a series of blows assaults the person from the outside. And then immediately after the event, shock and denial are typical. Traumatic events can happen, can become quickly internalized in the mind and can really impact the individual. So there's two types of trauma. There's acute trauma and then there's chronic trauma. Acute trauma happens when an incident was really intense, however, it only happened once. So some examples would include an accident, violence in the community, which can be either acute or chronic, and then going through the death of a loved one. Again, this was really intense, however, it only happened once, but it can still really impact an individual. And then chronic trauma is repeated and prolonged. These events, sorry, I can't see my screen, are severe and pervasive, and some examples might be domestic violence or undergoing abuse, because they happen repeated and they're for longer periods of time. So that would be a chronic trauma. And then some examples of traumatic experiences would include bullying. This is something we would see more in children and adolescents. They're going to school and, they might be going through this with their peers. That might be a reason why they don't want to go to school. Going through homelessness is a very traumatic experience, losing your home, not having basic necessities, shelter, where you're going to sleep, food. Those are all traumatic experiences. Going through a disaster, natural disaster, an earthquake, a tornado. And then early childhood trauma, if they experience neglect, either emotional, physical neglect, those are all traumatic experiences. Intimate partner violence, domestic violence. Medical trauma, either being impacted by a chronic health condition or being in a car accident, losing a limb, can be a traumatic experience. Being physically abused. Refugee trauma, I think of this as leaving your country behind because maybe the conditions there are not safe, having to come to a new country or a new place, having to leave all that behind. That can be very traumatic of moving to a new place, new language, maybe not being able to get the documents you need to do well in the other country can also be a traumatic experience. Going through sexual abuse, and then terrorism and violence. Right now we're going to go over community violence, and that can also be a traumatic experience. And then going through traumatic grief of losing a loved one can also be very traumatic. And then these are some images of the impact that physical abuse and neglect has on the developing brain. These are two brains of two 3-year-old children. The image on the left is that of a healthy child. You can see it's a lot bigger. And then the image on the right is of a child who is a Romanian orphan who suffered severe sensory deprivation. The right brain is a lot smaller, has enlarged ventricle holes in the center of the brain, and it also has a shrunken cortex, which is the brain's outer layer. And then the cerebral cortex is responsible for higher thinking functions, such as speech and decision making. And then the prefrontal cortex can also impact the emotional, behavioral, and cognitive regulation. So we can see how physical abuse and neglect had a big impact on the development of young children, and this can later impact them later on in life. So then there's also vicarious trauma. Vicarious trauma is sometimes referred to as compassion fatigue. It describes the phenomenon generally associated for the cost of caring for others. And then other terms used for compassion fatigue are secondary traumatic stress or secondary victimization. So I'm going to have a question for you right now, but this can happen to a lot of people who work directly with people in the community, family members who have gone through traumatic experiences, such as therapists, teachers, educators, nurses, social workers, case managers. If you're working directly with individuals who have gone through a traumatic experience, or even if there's a child and they're living in a home and they're witnessing their family or their mom or their dad constantly fighting or going through worrying about how they're going to pay rent, that can be vicarious trauma, and that can then start impacting them. So question for you that you can answer on the chat box is, what are some strategies that we can use to prevent vicarious trauma so that we can make sure that we are taking care of ourselves and that we can then help those that we serve? So I'll give you a minute.
Let me unmute myself. Self-care, take care of ourselves, leave work at work. Self-care and take time off if needed. Speak with people to process emotions. Open dialogue about feelings, professional boundaries.
Those are all really great. Thank you for sharing. Yeah, those are great strategies. Self-care, doing hobbies that we enjoy doing, going outside, being in nature, talking to our loved ones. Yeah, leaving work at work, being able to separate, and then also having a strong community at work, talking to our coworkers, and just that way we're able to take care of ourselves so that we can be our best selves when we're serving others. So last year I was actually working in education, and I was working with children, and I would get I'd have to lesson plan after, and I would get really tired, and I wasn't sleeping enough. And then I found that when I was sleeping more, my mood shifted, and I felt a lot better. So it's really important that we take care of ourselves so that we can be present and be energetic and feel good. So thank you for sharing. And then these are some common reactions to trauma. So if someone has gone through trauma, they might be in disbelief. They might not, they might be in shock of what's happened and might not really believe it. Might be in denial, this didn't happen, things are going to be okay. Emotional numbing. They might go through nightmares and other sleep disturbances. They might be angry, moody, or irritable. they might be forgetful, have flashbacks, have survivor guilt, be hypervigilant of what's happening, especially around, we're going to go over community violence and how, like, if you hear, like, gunshots in the community, if you're in the classroom, if there's a child in the classroom, they might be, like, more hypervigilant. If they hear a loud noise, that might be a reaction to what's going on. Having loss of hope, social withdrawal or isolation, increased use of alcohol and drugs, which might go back to, like, emotional numbing, are all different reactions to trauma. And then our next question is, how does undergoing a traumatic experience impact one's mental well-being? If you can take a minute to answer in the chat box.
Depends on the person and their supports. It creates a lack of trust in the world, grief, confusion, feeling anxiety, creates stress, potential PTSD.
Yeah, thank you for sharing. Those are all great. Yeah, it does depend on each individual, and you're right, like, everyone has a different support group that can impact, like, how they react to it and how their mental well-being is impacted. It can also lead to PTSD or a mental health illness later on. One thing I've been noticing is that a lot of schools are pushing for trauma-informed practices in the classroom, having, like, cool toys that kids can play with, teaching teachers or educators how to be more aware of how to handle certain behaviors in the classroom, so that we are able to, again, like, handle behaviors differently, to make sure that a child isn't impacted by what's going on in the classroom, because they might be going through something at home, or they may have undergone a traumatic experience outside of school. So thank you for sharing. And then, so someone mentioned that it can lead to PTSD. So post-traumatic stress disorder is an anxiety problem that develops in some people after going through a very extreme traumatic experience. So an example of this would be going through war, combat, witnessing crime, being in an accident or a natural disaster. Those can be traumatic experiences that might lead to post-traumatic stress disorder. And then, while most crisis events are limited, long-term exposure can lead to post-traumatic stress disorder and other anxiety or depressive disorders. Having anxious feelings that they didn't have before, that are so intense that it might impact their, like, daily functioning. And then people who have PTSD, who are going through it, might relive the events via intrusive memories, flashbacks, and nightmares. So it's very important that we avoid anything that reminds them of this trauma. And then some symptoms of post-traumatic stress disorder include flashbacks, so remembering the event that happened, having nightmares, sleep disturbances. It might change the way they're sleeping, having avoidance behavior, feeling guilty, loneliness, depression, severe anxiety, being hypervigilant, more aware of their surroundings, and then having an inability to focus and reliving the moments of trauma are all different symptoms of post-traumatic stress disorder. And then another form of trauma is community violence. So community violence is exposure to intentional acts of interpersonal violence committed in public areas by individuals who are not intimately related to the victim. Community violence can happen without warning. So this is Spanish translation, and this is by the National Child Traumatic Stress Network. And then, who is impacted by community violence? I got this from an article called Community Violence in Youth, Effect, Behavior, Substance Use, and Academics. So community violence affects all racial and ethnic groups. However, ethnic minority, especially African American children, are disproportionately affected by community violence. And then over 80% of children living in urban areas have witnessed community violence. As many as 70% of them report being victims of this violence. So that's a large amount. This is also from like 20 years, so there is more recent research done on this, and I'm sure that it might still be impacting communities. There has been an increase around mental health awareness, so this is one type of trauma that is important that we are aware of. And then it impacts inner cities, but can also have adverse implications beyond inner cities, more likely to impact communities who are more impacted by crime. Communities are impoverished, ethnic minorities, communities that, again, are impacted by crime. Communities impacted by violence are also impacted emotionally. I can't read this. Behaviorally and academic might impact their academic achievement, and it also correlates with anxiety, depression, disruptive and aggressive behavior, substance use. There may be school disengagement and academic failure. So I don't know, when I think of community violence, I think of like gunshots. I've also grown up in communities that have been impacted. Sometimes I, saw like drive-bys, and again, when I was working with some students in the classroom, I would hear them telling me like, there was a helicopter yesterday by my house, and they were looking for someone, and there's gunshots. And so if we're thinking about children, sometimes when they have to go to school, they might have to walk alone, or sometimes if they walk with their parents. If they're living in a community that is impacted by community violence, they might be at an increased risk for like getting hurt. And then this is really important. Community violence is recognized as a major public health concern, and this is by the World Health Organization. And
there's a question here. Sorry.
Yes, go ahead.
There is a question here in the chat box. It says, I finally left a domestic violence relationship, excuse me, and my dreams stopped. This has been since 2001. Is this normal reaction?
Yeah, I think the best thing you can do is get seek help from a professional, like a therapist, because then they can make a professional evaluation and help connect you to proper services such as therapy. And then when you go through therapy, when anyone goes through therapy, they use evidence-based research to help the individual like process what has happened, because it might be that event is now impacting like you or the individual today. My role is more in education, and I do outreach around mental health, and then I work closely with like schools and community members, and then we help connect the therapist to schools and to children to make sure that they're getting resources. But I always advise people to get help through a licensed therapist so that they can then help out. So thank you for asking that. And these are some quotes I got. Yeah, no worries. Thank you. These are some quotes that I got from the National Child Traumatic Stress Network on community violence. So these are some children who said, like, I don't know who to trust anymore. Pretty like scary. I'm on the edge all the time, like something's going to happen. I'm caught off guard. I worry most about my little brother or sister getting shot, which is really scary. Thinking about just being a child and having to worry about the well-being of your own siblings, and how, unfortunately, sometimes if we're impacted by other socioeconomic factors, like not having, a job that pays enough, then that can impact where we live. And then communities that are more impoverished are then might be impacted by community violence, and it's not like sometimes we have a choice. Like sometimes it's just, we have to live there, and children might have to walk through certain streets to get to school that aren't that safe. So that can be, very scary. Sometimes thoughts pop up in my head, and I'm right back to the night my world changed. So maybe they've lost someone they love due to community violence. I'm more tempted to get drunk or high to numb it all. I get jumpy or nervous at the smallest things or little sounds. So again, I think about like being in the classroom, the way that sometimes maybe like being a teacher, like you do have a large class size, but if we're addressing behaviors, instead of like quietly talking to the child, if we're addressing the child in front of the whole classroom, they might get like jumpy at certain ways of being addressed, or even like certain noises might be alarming. I just can't stop thinking about all the violence, how it's never going to end. And then these are the same in Spanish. And then so after trauma and community violence, we're going to go over grief. So the National Alliance on Mental Illness, this is a quote that says, "One thing we know for sure is that the only way to get out of the severe pain is to go through it. Grief is a necessary and healing process." So grief is a natural emotional response resulting in a significant loss, especially the death of a loved one. It is the process of psychological, social, and somatic relationships to the perception of loss. So after we've lost someone or gone through a major loss in our life, grief is a natural healing process to help us heal. So this is, I just repeated it, sorry about that. So grief is a natural healing process. Everyone deals with grief differently, and then the time it takes for individuals to undergo grief differs for everyone. And so this is a worksheet, some information from Therapist Aid. I was able to get some resources from some other therapists. They here states that for others, grief can become, complicated and can turn into depression or anxiety. It might last too long, and it can become complicated grief. So again, grief is a natural healing process, but if this is starting to affect someone's like daily functioning, it might become complicated grief. And then in that case, it's important to get help from a licensed clinician, and then it can help give you strategies to process that grief. So then below is like a little picture, and it says normal grief varies greatly between cultures, people, and situations. So it does vary for each individual based on their own cultural background, beliefs. Grief is a natural process and does not require treatment. We all go through loss. It's a natural process that we go through. But again, if it becomes complicated grief and it starts affecting our ability to function every day, then that's when we might want to seek help from a therapist or someone who is licensed. And then about 10% of people develop complicated grief after a loss, and complicated grief can be treated with psychotherapy, which is a evidence-based practice that therapists use when they're helping the individual process grief. And then here is the normal grief process. There's acute grief, which is, again, happens after the loss and can happen for months or might be a year afterwards or more time. It's normal to have intense symptoms of shock, distress, sadness, poor appetite, sleep trouble, and poor concentration. These symptoms will slowly diminish with the passage of time. Complicated grief, however, is when these symptoms are not going away and they start taking longer time, might start taking years, and it really starts affecting our like everyday life. So then in that case, it's okay to get help and to help process what we've been through. And then integrated grief is after resolving the most intense symptoms or acute, this is blocking it. For complicated grief, you will enter the lifelong stage of integrated grief. At this point, you will come to accept the reality of the loss and you've resumed daily life activities. This doesn't mean that you miss your loved ones any less or that you don't feel pain at their memory. You've just learned how to cope with the loss. acute grief may show itself again, especially around holidays, anniversaries, and other reminders. So when there's certain special days, we might remember our loved one more, and we might be feeling those, the grief more certain times. But that's a healthy process in going through grief. And so there's a psychiatrist, Elizabeth Kubler-Ross, who created this grief cycle. There's 5 different stages to the grief cycle, which include denial, anger, bargaining, depression, and acceptance. So while there are 5 different stages, they're not linear and they don't go in a specific order. Everyone, as I mentioned previously, goes through grief differently depending on their own beliefs, their own cultural beliefs and background. Someone might go through denial, and then they might go through depression, and then they might go through acceptance, and then it might be a year later, and then they might come back and feel anger. So it kind of happens for everyone differently, and they might experience each stage at different periods of time, or they might only go through one stage, like anger, and then time will pass, and then again, like they'll come back to it. And so I'm just going to share a personal story. When I was younger, I was in high school, my dad passed away from a heart attack, and I remember we came home, and my mom, it was very difficult, but my mom kept saying, like, if I had stayed with him that night, like, he wouldn't have passed away, or if we had gone to walk more often, he would be more healthy and he would still be here, or if we would have ate healthier, like, this wouldn't have happened, or if we would have gone to the doctor, we could have prevented it. And while they might be true, sometimes we try to bargain with what has happened to try to make sense and take control of the situation, which is a normal process in the grief cycle. But unfortunately, sometimes we can't control these situations when they happen, and we just have to process what has happened. And even though we're still grieving and we still remember our loved one, we learn to continue to move forward in life, keeping their memory with us. So we all might go through grief at a different stage in our life, and these are just different stages that one might go through that are important to keep in mind. And then what are some symptoms of grief? So there are physical changes, emotional changes, and cognitive changes. So physical changes might include headaches, changes in our sleep pattern, feeling fatigue, changes in our appetite, having aches and pain. And then emotional changes might be crying more often, changes in one's spiritual beliefs, especially if you've lost a loved one, you might, start questioning your spiritual beliefs, feelings of detachment, isolation from family or friends, wanting to be alone. Cognitive changes include being more worried, anxious, frustrated, give me a second, being angry, guilty, abnormal behaviors, feelings of despair or stress. And again, grief is a natural process, but these are different symptoms to look out for. And if you notice that it might be impacting someone more, and it might start impacting like their ability to function every day, then it is okay to seek professional help so that they can help us process this grief. And then so I'm going to ask a polling question, chat box question, and this is, what are some concerning behaviors we might see in children and adolescents that might indicate they might be going through a mental health disorder? So we've gone through depression, trauma, different types of trauma, community violence, and then grief. So I want to now ask, what are some behaviors we might see in children or adolescents, or even an adult, that might show or be indicative that they're going through a mental health disorder? So I'll give you a minute.
Self-harm, anger, aggression, detachment, hitting, yelling,
Yeah, those are all correct. Those are different signs that we might see. Thank you for sharing. Yeah, tearing up in the classroom might be one as well. That something's going on. And instead, sometimes it's important that we regulate our emotions because we were working directly with children. If we're feeling upset, it's not going to help. We need to be calm. And when we're feeling calm, then we can talk, just with the example of like, if we see like an anger outburst or maybe like throwing things in the classroom, like we need to be calm and then we can talk to the children to help them. But yeah, some concerning behaviors are social withdrawal, having anxiety, extreme fears or phobias, being irritable, frequent sadness or crying, difficulty concentrating, you might see that at school, anger outbursts, fighting, tantrums, that might be another sign that something is happening, signs of alcohol or drug use, emotional numbing. If you notice that their grades in school drop, that might also be a behavior to look out for, defiant behaviors. If they've gone through a traumatic experience, that can also impact their mental health later on. Then we talk about resiliency. I didn't include that in here, but we can also teach our children different ways of being resilient so that they can learn to go through the traumatic experience. Being more hyperactive, and then problems in the relationship are also different signs that something might be happening. Thank you
There's
for sharing.
a comment here
then,
that I'm gonna share before you go to the next point. It says client not wanting services, not enough therapists, or not enough mental health resources available.
Yeah, that's true. Unfortunately, that's something that we're seeing. We're gonna go over like different barriers to mental health services, but there is a need, and we definitely, there are not enough resources, and that's something that I think we need to policy changes to work towards that. But we're all doing our best, and yeah, but that's a good point to bring up. Thank you. The next question is, what might be possible barriers to mental health services, such as one that you just mentioned? But if you can take a minute to share as well.
The stigma around receiving services, cultural beliefs, financial resources. Wait time.
Yeah.
This one went too fast. Parents in denial about a child's needing therapy. Transportation.
That's a good one, yeah. Yeah, in rural areas, true.
Being judged for asking for help.
Yeah. Yeah, thank you all for sharing. Those are all really all true. And then language barriers, it's hard to find therapists who speak the same language. That's true as well. Thank you. Yeah, as you mentioned, not enough resources available, maybe not having insurance. A lot of providers ask for private insurance or Medi-Cal. Sometimes there are people who can't get either. There might be social cultural barriers that impact access to mental health services, systemic oppression in delivery. If you don't have access to insurance, then it makes it more difficult. Fear, shame, guilt, or being in denial of what we might be going through. That makes it harder to access mental health services. Lack of familial support is another one. Lack of environmental support, again, as someone mentioned, if you live in a rural area, there might not be enough providers, or transportation is an issue, might be harder. And then unfortunately, there's still a big stigma around mental health. So we're working towards that, and I think through education and awareness, and if we're more open about what we're going through, then it'll open up that space for others to share how they're feeling so that we can create community. Even like hopelessness, or if you're going through a mental health condition like depression, you might not know where to start, or you might just have feelings of like hopelessness where you're just like, I don't, and so it's important that we look out for those signs and those behaviors so that we can help someone who might be going through depression, because sometimes they, it's not that they don't want to, it's that the depression can be so impactful that it can start impacting like their ability to get up from bed or go to work and talk to people about how they're feeling. So these are all different barriers, and then all the ones that you mentioned are also correct, and thank you for sharing. It's just important that we're mindful of it because that way we can help bridge that gap. And then the next question is, if we believe someone might be undergoing a mental health condition, what can we do to help? So I'll give you a minute. Yeah, support and encourage them. Listen, be supportive, encourage to seek professional help. Facilitate change talk and increase self-efficacy. Yes, those are great. Yeah, so encouraging the individual, being open about mental health, asking them how we can provide that support, provide resources, talk to parents about it. Those are all great to raise awareness. But also promoting like self-efficacy is really important. That way they can also like seek the resource themselves and advocate for them, but also have them advocate for themselves. Be non-judgmental, encourage and offer help. Yeah, those are all really great. I think we're already doing the work, so thank you for sharing. So yeah, as you've mentioned, reach out and offer to help. Let your grieving loved one know that you're there to listen, whether it's they're grieving or they've gone through a traumatic experience or they shared that they're going through a mental health condition. Knowing that everyone experiences grief differently and for different lengths of time, or that they might be going through like a traumatic experience. Everyone goes through it differently, and then offer to help in practical ways and maintain your support. So in any manner that you can, just offer to help, let them know that you're there, and continue to maintain your support and continue to check in on the individual. And then these are some important signs to recognize, sorry about that, of suicide. So if you notice that someone begins to talk a lot about death, like I want to disappear, or they just talk a lot more about death, or the world would be better if I wasn't here, those are evaluation. They can get the PET team who helps in response and helps evaluate to see if they can get connected to resources from there. And then get the person appropriate help, and help is available 24/7. This is the website for the suicide prevention, and then the phone number, and it's available 24 hours, 7 days a week, and you can see it in English and Spanish. And then this is specific to Los Angeles County. However, every state, every county should have their own phone number. This is access through the Department of Mental Health in Los Angeles, and they're open 24 hours a day, 7 days a week. And they're the main entry for mental health services in Los Angeles County. So if it's an adult who's seeking mental health resources, or if there's a specific language, Spanish, or any other language that you're looking for, they can help see which providers have it. If they're looking for resources for a child or an adolescent, there's specific ages, or if a person might require hospitalization, they can also help provide that information. And And they can also provide information on which agencies provide like sliding scale or insurance or Medi-Cal. So they're the main entry point for seeking mental health resources, specifically to LA. But again, every state should have their own point of contact. And if you need help, you can always reach out to me, and I'm more than happy to look for those resources as well. And then there's 211 in LA County, and they also help see like what different providers there are. And then my last question is, who can help improve the mental well-being of kids, adolescents, and adults in the community? So if you can help answer this one, just take a minute. Yeah, all of us. Anyone who is willing to listen and care, increase prevalence of mental health, it takes a village. That's correct. Yeah. We can all help. So, like you've all mentioned, we can all help out. All of us help make a difference, and we can help be there for community members, children, adolescents, adults, each other. Listen to what others are going through, and look out for different behaviors that might indicate that someone might be going through a mental health condition, so that we can help provide the help, support, and the resources, and be there. And this is my last video. It's really short, but it talks about trauma and how being there for children can help them heal. I'll play it for a little.
Early childhood trauma changes the biology of the brain. So early childhood sports also changes the biology of the brain. What studies of resilience show that even when children have insecure attachments at school, they've had at least one secure attachment with a daycare provider, preschool teacher, or another adult in their lives. And that makes a huge difference in having seeds of resilience. These who have difficulties, once they've had one secure relationship, the relationship that they felt, and another individual or adult knows them, feels well inside of them, those kids have potential. We can see imaging today of before and after trauma and see what happens in the brain, and we can also see care that happens in the brain when our intervention is successful. What makes children get better following a trauma is connection to other human beings who are present, who are patient, who are kind, who are sensitive. They don't need to be necessarily psychologically insightful. They don't even know anything about trauma. All they need to know is that they're right there with the child. They're trying to be comforting, they're trying to be supportive, they're trying to encourage. Those kinds of interactions can be much more therapeutic than making the other. Teachers can work towards the children, be more emotionally present for children, touch them, work on their own nervous system and their own regulation. If they're angry and they're out of control in terms of what's going on inside of themselves, the message that they're going to convey to the child is, I'm angry and I don't like you. If you're an adult and there are people that you're in law enforcement, a teacher, a parent, foster parent, whatever you are, and you know that a child has been exposed to something that first thing that you should be aware of is that not all traumatic events lead to disasters in mental health outcomes. In fact, the vast majority of children that are traumatized actually do pretty well. But they do need your attention, they do need kind support, and they do need your awareness about what are warning signs that would tell you to actually take the next step and try to get them professional. It's up to us. We can't wait for a day to do this, spreading of the message that we can do something about it, that children, especially young children, have the most possibility for health and plasticity, for overcoming these early traumas if we as a community, a large community, support them. We have permission now to children.
So that was the part As mentioned, we just providing our support, having someone who is there, who cares, can really make a difference and help a child who may have gone through a traumatic experience, being present, and also like if making sure we feel good too, so that we're present for those that we are helping and serving. So thank you for joining me on this webinar. If you have any questions, I can provide Carrie with my information to share with you all. But these are the different resources I use to help me get more information. And I'm more than happy to help connect to any resources you might want to look for in your community to help individuals that you're working with. So thank you all for joining, and I hope you all have a good day. So, okay, Carrie, I think that's it.
So before you all leave, just a couple of more housekeeping things. First of all, thank you, Maribel, for a wonderful presentation that you gave us today. I just want you to know that this is being recorded, and if you go to our Strategies 2.0 YouTube channel, you can see this webinar presentation today if you wanted to get staff together to show it to staff. Also, other past webinars are available to you. Things that have happened in our learning communities that take place throughout the state are all available on our Strategies 2.0 YouTube channel. Following this presentation, you should automatically get an evaluation that will show up. We encourage you to complete that for us. It really helps us in the work that we do. I want to let you know that our next webinar will be next Friday, March 13th, also at 10 o'clock. And it is going to be a wonderful story of addiction and surviving addiction that a woman is sharing about her family and the opioid crisis that we have going on in this country. So go to Strategies 2.0 to register for that webinar. And with that, thank you all for being here. We really appreciate your support for all that we do. And everybody have a great day. Thank you so much.
Thank you.
Mm-hmm.